Hi, Catherine. My name is Kayla. I'm going to be your nurse today. I'm cleaning my hands. How are you?
Fine.
You're doing fine? All right, well, I'm going to close this curtain to give us privacy. I'm here to do a head-to-toe assessment, and I'm just going to be making sure that everything works good and checking out for any abnormalities or anything that might be causing you any problems, okay? That sound good to you? All right. Well, can you tell me your name, age, and date of birth so I can check it with your ID band?
My name is Catherine. I'm 10 years old, and I was born in 2010. My birthday is May 13th.
All right. Good job. All right. I'm just going to start with a general assessment and ask you some really easy questions, okay? All right. Can you tell me where are you?
I'm in Mom and Dad's bedroom.
Okay. Do you know what year it is?
2020.
2020. Okay. And do you know why are you here?
I am helping you with the head-to-toe assessment.
All right, good job. And I know those seem like silly questions, but when I ask questions, I can tell how your speech is and how cognitive your mental acuity is. So you're really good. That's great. All right, so now we're going to move on to, I'm just going to start a general inspection, and I'm just going to be looking over your whole body, and I'm just looking for anything that might kind of jump out at me. I'm looking at your skin tones for any obvious lesions or masses, or just anything irregular. And I'm looking at your appearance, and you're dressed appropriately for the place and the season. You have good hygiene. I'm not having any mouth odors, which is good. Client looks relaxed and isn't stressed or anything by the situation, so that's good. And I'm looking for overall symmetry of the body, and everything's looking good. Client is aware of where she is and what we're doing, and everything just looks really good. Facial expression is relaxed, and I have another question. Have you recently gained or lost any weight?
I don't know.
You don't know? Okay. Do you know what your current body weight is?
Yes, I'm pretty sure it's 57 pounds.
Okay, you think it's 57 pounds? All right. And you know how tall you are?
No?
No? That's okay. Well, you said that your age is 10, right? Okay, well, your body weight looks appropriate for a normal 10-year-old. Are you pretty active?
Active, yeah.
Okay, well, that's good. Okay, well, I'm going to move on and start by inspecting your head. And I'm just looking at your head shape and color of your skin and your hair. And I'm noting that your hair is brown and it seems decently thick. It's a little tangled. So probably should brush that hair out a little bit. I'm just looking at the back of your head. And your head looks symmetrical and a decent proportion to your sized body. Okay, and so now I'm going to palpate your head, and I'm just feeling for any bony protrusions or masses. Doesn't feel good. I'm not feeling anything abnormal. Head feels good. All right, and I'm just going to look at your scalp, and I'm looking at your hair line, making sure I don't see any lesions or scabs or anything that might need to be noted. Okay, looks good. All right, so that's the head. All right, I'm gonna move on to your face. All right, so I'm looking at your face for symmetry, and when I look at symmetry, I'm looking at the eyebrows and the nasal folds of the front of the face, and I'm going to just feel for your skin temperature, which is nice and warm.
Probably not anymore.
Probably not. Are my hands cold? I'm sorry. Okay. Let's see. So we looked at the eyebrows. I'm going to palpate your temporal arteries, which are right here. And I'm just feeling for elasticity and movement. Okay. And now I'm going to check your cranial nerve number 5. And I'm going to get you to clench your teeth for me like this. Can you relax? Clench again. Relax. Okay. And that's testing your temporal and masseterial muscle contraction, which is good. All right. I've got a safety pin here, and I'm going to get you to close your eyes. But first, okay, I'm going to show you. So this is sharp, and this is dull, okay? So I'm going to get you to close your eyes and tell me what you feel. Put your hands down. Just tell me what you feel.
Dull. Sharp. Dull. Sharp. Dull.
Okay. Now, can you tell? I want you to close your eyes again and just point to where you feel me touch you at. Okay. Okay. Nice testing for sensation and dull and sharp on the face. Good job. Okay. And now I'm going to test cranial nerve number 7, which is the facial nerve, and I'm going to get you to make some faces at me. Can you smile and frown and puff your cheeks out? Okay, and raise your eyebrows. Okay, so the facial nerve is intact and working good. Good job. All right, so that concludes the face. All right, now I'm going to move on to your sinuses and your nose. So I'm just going to start by looking at the external part of your nose. Again, I'm looking at symmetry and the color, even coloration. Can you look up just a little bit for me? Nasal septum is midline. And can you put one finger over your nose like this and breathe in? Okay, do those up. Any trouble breathing through your nose? Okay, good job. So equal airflow through each side of the nostril. All right, I'm going to get you to tilt your head just a little bit, and I'm looking internally at the nose, at the mucosa, and it's dry, no runny nose, and it's nice and pink, and it looks good. So there's no abnormalities in the nose. And did that, okay. So now I'm going to percuss your sinuses, and I'm going to start with your frontal sinuses, which is right above the eyebrows. So look here. I'm just going to make sure I don't hear any crepitus, and I'm doing your maxillary sinuses. All right, does that hurt? Any sensitive? No? All right, well, I'm going to percuss as well, and just feel your sinuses in it. Okay. Any pain or tenderness? No? Okay. Feel the nose, palpate the nose. Any pain? No? Alright, all good. Alright, now we're going to do the mouth. So I'm going to put my gloves on, and I'm going to inspect the mouth and the throat while I have my gloves on. Alright, can you open up for me? So I'm just going to be inspecting. You can just relax, you don't have to open wide. Alright, I'm just inspecting the color of the lips, which is nice rosy pink. You can open it, just gentle. And I'm looking at the teeth. Tilt your head just a little bit for me. And I'm just observing the overall structure of the mouth. I don't see any fillings or cavities, so that's good. And I'm going to use the end of the spoon as my tongue depressor. So I'm just going to get you to open your mouth again. Wide, okay. And I'm looking at the tongue, which is pink and has lots of little papillae on it. And can you touch the roof of your mouth with your tongue? All right, looking at the underside of the tongue, I can see the veins, and the frenulum is midline of the tongue. It's nice and shiny. Okay, tilt your head like this. Nice and shiny bottom gums. The Wharton ducts are intact. Frenulum's intact. No signs of oral cancer. Just keep your head like that. All right, open again. All right, let's take your tongue out. And I'm looking at the inside of the gums, which is nice and shiny and pink. And I'm looking at the hard and soft palate. The hard palate is, open a little wider for me. Okay. Hard palate is pale and has a little row on it. And the soft palate is pink and fleshy. And I see the uvula. You see your tongue up. Open your mouth. The uvula is intact and midline in the back of the throat. And tonsils are grade 2. And say ah. Soft palate and uvula move up when client says ah. Alright, I'm going to look at one more thing. Look at the Stinson ducts, which is back by the molars, which are also intact and looks good. Alright, your mouth looks great. I'm going to use my paper towel as a gauze, and could you stick your tongue out for me? And I'm just going to look at both sides of the tongue and make sure that they are nice and shiny and smooth. Alright, good job. So that is the mouth and the throat. I'm taking my gloves off. Now I'm going to inspect the neck, and I'm looking at symmetry. I'm not noticing any masses or lesions. Got a little scratch right here on the right side. How did you get that scratch?
No, I have one right there.
Did a cat scratch you?
I don't see a scratch.
It's right here. Right there. There's a little scratch. Let's see. All right, we're gonna check your range of motion for your neck, okay? Because I don't see, everything looks good. You got this down pat, don't you? All right, put your shoulder. Okay, look up, look down, side to side. All right, good job. So you've got a full range of motion of the neck. When she swallows, the trachea moves with her throat. I don't see any bulging pulsations, which is good. All right, I'm going to palpate your trachea, and so relax. And I'm just going to palpate the tracheal rings. Let me know if you feel any tenderness. Any tenderness? No? Okay. And I'm going to come behind, and I'm going to get you scoops like this. And I'm going to do the thyroid glands. Any pain or tenderness? No? Okay, and can I get you to look down? And C7 is palpable and visible when client has her head bent over. Okay. Now let's test your cranial nerve number 11. I'm going to get you to shrug your shoulders up against my hands. Good job. Okay. And you can relax. All right, turn your head against my hand. Okay, same side. Good job. So cranial nerve 11 is intact and movement is good. All right, now I'm also going to palpate all the lymph nodes. So I need you to relax. Just lift your head up. All right. And I'm going to start behind the ear with the preocular. Oh, no, I'm sorry, in front of the ear. The preocular lymph node. I'm going to go to the posterior ocular, the occipital, the tonsillar, which is right here. Let me know if you feel any tenderness, okay? Okay, the submandibular, submental, okay, the superficial cervical, the deep cervical chain, which is all the way down the neck, the posterior cervical, and your subclavicular. Everything feels good. No tenderness? All right, good. All right, now I'm going to inspect the arms. And I'm just looking at symmetry of the arms and the hands and the fingers. And coloration is even. I'm not noticing any body art or abrasions or bruising. There's another scratch right here. How did you get that? You don't know? Do you like to play outside? Yeah. All right. Look, I don't see any signs of edema. Very skinny arms. All right, I'm going to just palpate for temperature, which is even body temperature, nice and warm on the arms. Skin is soft and smooth to the touch. No abnormalities and no edema. I'm feeling for edema, palpating. There's no signs of edema in the arms. That's good. All right, I'm gonna check your brachial pulse. So you just stay out here. Okay, it's a 2 in that arm. I'm gonna get you to put your hand inside. It's a 2 there too. Good job. All right, and I'm also going to look at your skin turgor and check for mobility and elasticity. So if you can, I'm gonna pinch you right here. Just pull a little piece of skin up, and your skin goes right back down. So elasticity is good. Now I'm looking at your hands. They're nice and warm, symmetrical, good hand hygiene. I'm palpating the capillary response in the fingers, and it's under 2 seconds, which is within normal limits. Good hygiene. And I'm going to palpate your radial and ulnar pulses right here. So 2. And the ulnar is a little fainter in that arm. All right, let's look at this one. Just relax. 2 and 2. Let me look at this one again. Okay, there it is. I wasn't. All right, even on both sides. All right, now we're going to do this thing called Allen's test. So I'm going to get you to clench your hand. Okay, keep it clenched. And I'm going to close off the radial and the ulnar arteries for just a second. All right, open your hand up. All right, now we're going to look for color to return your hand, okay? Ready? Color immediately returns. Hand turns red back immediately. All right, you want to do this one too? All right, close your hand. All right, open it. And color returns to the hand immediately. All right, so that's the hands. All right, now I'm going to move on to your chest. Well, first we're going to look at the carotid arteries in your neck. Okay. So lay back for me. I'll scoot back, just lay right there. All right, so turn your head this way to me just a little bit. All right, relax. And I'm just inspecting to see if I see the carotid artery impulse. And I can see it faintly right here. And I'm going to auscultate the carotid artery. Okay. And I am going to use the bill of my diaphragm. Okay. I'm going to get you to hold your breath for me. Okay, got even rate and rhythm. Turn your head. You can breathe. All right, hold your breath. Okay, good job. Even rate and rhythm on both sides. And now I'm going to palpate the carotid arteries one at a time. Right, relax. Close your just a little. There you go. Okay, and turn your head this way to me. Just a little bit, not much. There you go. And it's a 2 on both sides. All right. Now I'm going to move on to inspection of the chest. Here I would ask the client to remove their shirt, but we're not going to do that here because you don't want to auscultate through the shirt because it can disturb your the sounds that you're hearing. But we are going to be looking through the shirt today. All right, so I'm going to start. I would start with just inspecting the chest posteriorly and anteriorly, looking for any abnormalities, any masses, lesions, ulcers, anything unnormal, moles, anything like that. And then I would move from inspection of the skin and also the temperature and symmetry. I'm observing the rise and the fall of the chest with respiration. So now I'm looking for heaves or lifts with heartbeat. And then I would move on to auscultation of the heart. And I'm going to start listening with the diaphragm on my stethoscope. And I would just relax. I would start I'm going to be listening for the rhythm. I'm going to listen with my diaphragm and the bell, because I'll listen with the bell to listen for any murmurs or bruise. And I'm going to start at the base of the heart, with the aortic, at the first and second intercostal space, just right here on the right sternal border, so I'm going to find your first intercostal space, and I'm just going to listen. And listen for S1 and S2, and then I'll move to the second and third intercostal space on the left side and listen to the pulmonic heartbeat, where S1 is much louder than S2. Then I'll listen to Erb's point, which is it's at the third intercostal space. Nice even rhythm. And listen to the tricuspid. And the apical. Okay, and I'm going to listen with my bell. Aortic, pulmonic, Erb's point, tricuspid, and apical. Okay, all sounds good. All right. And now I'm going to inspect the lungs, and I would start by noting the breathing rhythm and making sure that she doesn't look like she's having any trouble breathing by looking at the color of the lips, seeing if they're blue or pursed, and if there are any nasal flaring, but everything looks good and she's breathing normally. So I will start by noting, I would also do the symmetry of the thorax and everything, falling and rising, and the expansion with the chest with inspiration and expiration. So I'm going to start by palpating the chest, so you can lay back down for me and just stay down. And I'm just feeling for any lumps, bruises, any tenderness. No? Okay, I can feel the rib cage is very prominent in this client, very skinny. Okay, you can sit up, and I'm going to do the same posteriorly. Let me know if you feel any tenderness. Okay, while I'm palpating, I want you to say 99, and I'm going to be feeling for any temperatic dermatitis. Say 99. Just say it over and over again. 99. Can't say it forever. 99. Alright, I'm not feeling any vibrations with that, so that's good. Okay, now I'm going to check for chest expansion. I'll start anteriorly. So sit up. Okay, relax. Alright, when I say, I want you to take a deep breath in. Take a deep breath in. Okay, and out. My hands move symmetrically with expansion anteriorly. And I'll do the same here. Good, and breathe in. Breathe out. Good job. Alright, so that is, I'm going to percuss over the both sides of the lungs and the lobes. And I'm just feeling for resonance over tissues, and then there would be dullness over anything hard over flat bone. Lift your arm up for me. Okay, do this side. Put your hand up. Okay, I'm going to do the same on the back. Okay, good job. Okay, now I'm going to auscultate the lungs so you can lay back down. And I'm going to be listening for breath sounds. So I'm going to have you open your mouth for me and just take deep breaths. Please push your legs down straight. Okay, instead of just saying, let's prop you up a little bit. Okay, try again. There you go. Alright. I'm going to be listening with the diaphragm of my stethoscope. And on. So I'm just going to listen. Just open your mouth a little bit. Just a little bit. Take deep breaths. Okay, you can sit up for me. I'm going to do the same posteriorly. Just take a deep breath in. Alright, lift this arm up. Listen to the two lobes of the left. Okay. And listen to all three lobes on the right. Okay, good job. Sure.
Really lightheaded.
Okay, we can breathe normal now. Okay, so I heard bronchial breath sounds in the top posterior anteriorly, bronchial vesicular sounds more towards the midline on the front and back, and vesicular breath sounds on the sides and posteriorly and anteriorly. All right, so now we're going to do a couple breathing tests, and I'm just going to be listening to your back and listening to your lungs, and I'm going to get you to, first we're going to do the bronchoscopy test, and I'm just going to get you to say 99 a couple times while I listen, okay? Good.
99. 99.
Say again.
99.
99. Okay, so, and it's soft and muted, which is normal. And now I'm going to do the Goffany test. I just want you to say E. Yeah. Okay. And it's an E sound and not an A, which is normal. And now we're going to do the whisper test. I want you to just whisper 1, 2, 3, okay? Say it a little louder. Okay, and it's faint and muted. Just good. All right, now you can lay back and we're going to move on to the abdomen. Okay, we're going to lay you back just a little bit. All right, I'm going to pull the shirt up so that we can look at the abdomen. Are my hands still cold? I want my hands up. Alright, so I'm going to start with just inspecting the abdomen. I'm looking at the coloration. Her umbilicus is an outie. I see a small scratch right above the umbilicus. I'm looking for the aorta pulsation. Stay still, please. And I'm not seeing it, which is fine. It's normal. Okay. And so I'm just looking at coloration. There's no bruising or contusions or anything abnormal with the stomach. All right. So I'm going to just start with auscultation, because we want to auscultate the abdomen first so that we don't get an abnormal bowel reading if we were to palpate first. Okay, stop. Relax. All right, so I'm going to listen in all 4 quadrants, and then I'm going to listen to some of the arteries as well. And if I did not hear any active bowel sounds, I would listen for a full 5 minutes to confirm. But we have normally active bowel sounds in all 4 quadrants. And I'm going to listen with the bell, and I'm going to listen to well, first I'm going to listen with the diaphragm to the aorta. So just relax. Mine has a flat stomach. Okay, and I'm going to listen with the bell to the left and right renal arteries. Relax, stop sucking it in, which is on either side of the aorta. And I can barely hear the pulse, so very loud bowel sounds. And I'm also going to listen to the iliac arteries, which are down here. Okay, and I would also listen to the femoral arteries, but we don't have to do that today. All right, now I'm going to percuss the abdomen, and I'm going to, percussing, measure the size of the liver and the spleen. So just relax. Relax. Okay. And I should be tympanic since we're over just liquid. I'm not hearing any dullness, which is good. All right, and I'm going to listen to we're going to look at the liver, which is on the right side. So I'm going to measure from where I hear tympancy to dullness, and then we'll know that the dullness is the size of the liver. Can you please relax? Put your hands down to your side. Just relax. There's dullness right there. Okay, it's about right in there. All right, we're going to do the same over here with the spleen. Okay, now I'm going to get you to sit up, and I'm going to do a blunt percussion over the kidneys. All right, lay that down. And now I'm going to palpate your abdomen. So relax. Okay, let's pull this out. There you go. Now lay back. There we go. Is that better? All right, just relax. Don't stick your stomach up. And I'm just... Stomach is nice and squishy, soft, not feeling any masses or lumps. You having any tenderness, any pain? All right, relax, relax. All right, I'm gonna do a little deeper. I'm just feeling for any masses or abnormalities, okay? Tell me if you have any pain. All good? Okay. Okay. All right, right, sit up. We're almost done. Now I'm going to finish off with just inspecting the legs and making sure that they are symmetrical. And I'm looking at the feet and the toes and make sure everything looks symmetrical. There is hair present on the legs. There are a couple of small scars on the legs. Temperature is warm. Your toes are a little cold. Are your feet cold?
You're freezing.
Alright. There's no presence of edema. Alright, I'm going to check your popliteal pulse. Alright. Okay, so 2. This side. That's a 2. As well, I'm going to check the posterior tibial pulse, which is in the inner foot. Be still, please. So 2 there. Do this side. 2 there. I'm going to check your dorsal patelis pulse. Relax. 2. And 2. And capillary refill time is under 2 seconds in the toes. And that concludes our head to toe assessment. Yay!